The latest U.S. jobs numbers show growth slowed in November because of the coronavirus pandemic. According to the Labor Department, U.S. employers added 245,000 jobs in November. That is the slowest pace of monthly job growth since April. The unemployment rate went down to 6.7%. But that's because 400,000 people stopped looking for work and no longer count as unemployed. For more on this, I want to bring in Diane Swonk. She's the chief economist at Grant Thornton. Diane, welcome. Great to have you with us. So as I mentioned, this was the slowest pace of monthly job growth since April. What do you make of these November job numbers? What's the current behind them?
Well, actually, what we saw was the pullback in consumer spending before states started initiating more restrictive measures in terms of mobility, our ability to go out and congregate. The survey was taken the week of November 12th, and that was before that all happened. And what we saw was just the surge in cases in and of itself triggered a pullback by consumers. We saw restaurants close down. Hiring at restaurants actually fell during the month. And the normal seasonal hiring that we usually see did not occur. The only places we saw retail hires were actually in the areas where high-wage households who have been able to escape much of the worst economic effects of COVID were able to continue spending on everything from at auto dealers, hiring there went up, furnishings, as people are remodeling and redoing their home offices and upgrading their homes and also buying second homes. That's, a lot of high-end, high-wage spending, but it's not enough to offset the weakness we're seeing. Also, the gains in online, the shoring up of couriers, people dropping stuff off at your front door was not enough to offset the loss of employment across big retailers that usually happens this part of the year. And we know since then things have deteriorated more as we're going into December. We'll likely see a contraction in employment in the month of December.
Yeah, it's interesting. We discussed this a little bit yesterday, this sort of, lopsided economic recovery, if that's what you want to call it, because it doesn't look so much like a recovery yet, where we have the upper echelon, those people who, the high-paying jobs that were able to transfer very easily to working at home, they're spending and still spending, right? But that's not enough to support the entire economy, correct?
Well, exactly. What we're seeing is it is supporting growth, but not enough to regain the jobs that we lost to the crisis. We're still down 9.8 million jobs from February, 9 months in. That's 1 million more jobs than we lost during the height of the 2008-2009 recession. So it's still a lot of pain. We're also seeing the improvements in high-wage job gains that had been going on out there. Those are deteriorating, and even the composition of job gains among sort of the higher wage jobs, professional services jobs, overwhelming majority are temporary hires, as firms are relying more on temporary hiring instead of permanent full-time hires because of the uncertainty over the next several months, despite that hope on the horizon of a vaccine. And I think that reality is really starting to hit in, how unique this recession is. Fewer people participating today in the labor force. You noted the drop in the labor force. We've lost 4 million people in the labor force since February that were there in February, and they're not counted as the unemployed. If you roll those back into the unemployment figures, instead of going down, the unemployment rate actually went up in the month of November. 8.5% is our calculation. That's a big number. And I think, these numbers,
Absolutely.
when you look under the hood, it shows a lot more scarring as a result of COVID. And that's something we worry about as well. People who are unemployed over 6 months are now over a third of the unemployed.
And you're saying that these unemployment numbers and this sort of weakness at the bottom levels of the economy are starting to really cut into and eke away at what we thought was sort of a more solid position at the upper ends. Is that what you're seeing?
Exactly. And, if we know that the rapid increases that we saw in rebound we saw last late spring and early summer as the early reopenings occurred, that was underpinned by the CARES Act and the extraordinary support it provided to many of these households. You have, underscores this data with people unemployed more than 6 months. That's a tipping point. That's when both mental and physical health problems tend to start to rise. Unemployment is demoralizing. Family structure erodes. The well-being of children is hurt. We know food insecurity is rising. So as people who work from home are more isolated than ever from the reality of those who can't have a job today. Food lines are growing. The demand for food insecurity is rising quite rapidly. The demand on our food banks out there, which are mostly charitable donations, are really overwhelming. And we have to remember that, because even as Congress is thinking about getting a stimulus package in that will provide some additional aid to those low-wage families that are hit so hard, that's an eternity by the time it shows up. Even if they passed it tomorrow, it wouldn't show up until the end of the year or early next year. That's enough time for someone to go very, very hungry.
Absolutely. And of course, all of this is happening as many cities and states are continuing to reimpose some strict restrictions because of the surging COVID cases. For example, California is now at a stay-at-home order again, and health experts in almost every state are warning of a very dire winter. What do these restrictions that we realistically see on the horizon mean for the economy?
Well, it's going to, again, see a contraction in employment, likely from December through at least February, if not March, depending on how well we adopt masking and things like that to stem the spread of this disease. What we're doing is we're getting to the point where we're overwhelming hospitals so much that not only can they not take care of COVID patients, but they're on the tipping point, a brink of not being able to take care of non-COVID related emergencies. I know in my own area, some surgeries that require you to spend the night cannot be done right now. They've not put an actual end to elective surgeries yet, but the system is so stressed, and that's why we're so worried about overwhelming our healthcare system. And the irony is that we know that layoffs in the healthcare sector have already begun to pick up in the latter part of November. That happened in the spring as well, because elective surgeries were canceled, but also because people stopped going to physicians and dental offices. I talked to several doctors and dentists yesterday, and they're seeing the cancellations pick up and having to make layoffs now, not because people are so afraid of getting contagion at the doctor's office, but they're not, or a dental office, but they're not passing the screening to go into the dental office because they've either been exposed to COVID or now they actually have it.
Diane, very quickly, because we're running out of time, what's the outlook for retailers who usually recover whatever losses or whatever, their economic strength is usually this season, the holiday season? What is the outlook for those retailers this year?
If you can go online, you'll do well. If you can't be online, it's going to be very hard, and I worry about how many stores are going to close permanently by the time we get through this winter.
All right. Well, Diane Swonk, thank you so much for joining us. We really appreciate your expertise.
Thank you.